The main focus of this video is about how we can use radiation. So previously we talked about using radioactive atoms, but now we're talking about using the radiation itself in different ways, particularly focusing on medicine. Firstly though, let's go back and cover all the types of radiation that we've learnt about. So there were three main types of radiation that come from radioactive decay, which we've learnt about. We have alpha particles, and they're a particle. We've got beta particles, and we've got gamma rays as well. So the first two are particles. Gamma rays though, remember they're just a type of energy. And let's link it to the type of energy we learnt about when we were learning about light. And that's called electromagnetic radiation. Magnetic radiation. So here's the electromagnetic spectrum. The spectrum means going from one particular property all the way along to the other end of the property. So remember, electromagnetic radiation, it can change depending on its wavelength. It's still just light, but we can have long wavelength light and we can have short wavelength light. And gamma rays, they're a type of light, but they're right down the end with the short wavelength. And we can also see along the top that the energy increases as the wavelength gets shorter. So gamma rays are really high energy types of radiation. And if we go up a little bit to the longer wavelength section, we've got X-rays as well. So it's still a type of radiation, and it's another type of energy radiation. And then further up again, we get ultraviolet light. And UV light is what can burn our skin, and it's the main cause of sunburn. So again, that's another form of energy. So the main region we're looking at in this video is the short wavelength radiation, because it's that high energy that can do a lot of useful things for us when we design technologies. So let's look at some different uses of radiation in medicine. Uses of radiation in medicine. We've got a few examples here. The first one is one of the most common, and you've probably had one in your lifetime, especially if you've broken a bone. These are X-rays. So what we're doing in an X-ray machine is we're taking that X-ray radiation, which is still quite high energy, so they can be dangerous, and the machine sends that radiation through your body, just the part of the body that we want to scan. But X-rays are stopped by bones. So when the X-ray hits the bone in your arm, The X-rays that hit directly on the bone, they get stopped, and other X-rays will pass either side of it. So eventually we see a picture where the bones are a really dark colour because there's no X-rays there, but the other X-rays are picked up by a detector underneath, and they show up on the picture to make the lighter areas. So we have the radiation, it passes through the softer tissues of your body, like your skin and your muscles, but then it gets stopped by bone. And that's really useful for seeing if you've broken a bone or if you have something metal lodged in your body somewhere that they need to find. Another type of radiation that's helpful is radiotherapy. And this is for treating cancers. It's a really invasive treatment, so it does a lot of damage to people. There are a lot of side effects, but it can be helpful for treating cancer. And we're getting better at making safer technologies, safer versions of it. So radiotherapy, it's using even higher energy radiation than X-rays. It's really using gamma rays in this case. So it sends in the high energy radiation and almost like a laser beam, we're shooting that radiation right in and trying to hit the cancer cells to destroy them and trying not to damage any other cells in the process. Destroys the cancer cells. The other type of radiation therapy we can use is called systemic radiation therapy. And systemic means you're taking something into your body. So we actually take pills, or the patient takes a pill of a radioactive chemical, and then that chemical is sent, or the body sends that chemical to a particular location. And then once it's hit that location, it releases its radiation, but only into the neighbouring area. So hopefully it will destroy any cancer cells that are nearby. So the chemical targets the cancer cells and releases radiation into them. And we actually have to design special antibodies to make sure that the chemical goes to the right place. There is one common treatment for thyroid cancer, and this is a little bit easier because the thyroid naturally absorbs iodine as part of its normal job. So we can give people iodine 131, which is radioactive, and naturally the thyroid gland will absorb it, and that's a really effective way of treating thyroid cancer. For other cancers in different places, then it gets more complicated, and we have to actually design a way to send the chemicals to the particular cancer. So there are lots of useful ways we can use radiation.